Hello, everyone, and welcome to our COVID-19 update and story sharing webinar hosted by the Michigan Collaborative to End Mass Incarceration, also known as MySemi. My name is Daniel Jones. I am the project coordinator for MySemi, and I will also be moderating tonight's webinar. There will be time for question and answer, so if at any time you have a question, please utilize the Q&A feature at the bottom of your screen, and we will do our best to answer. I'm honored to have with us tonight an esteemed panel who will share their personal accounts of what life has been like amidst a global pandemic. We'll hear about what activists have been doing to help curb the impact of COVID-19 inside Michigan's prisons. We'll hear from someone who was incarcerated during COVID and what life inside prison was actually like. We'll hear from someone who has numerous family members and a fiance in prison and how their family has been affected by the impact of COVID on their loved ones currently incarcerated. And we'll also hear a public health perspective on why people held in jails and prisons should be prioritized for the COVID vaccination. And without further ado, I'd like to introduce tonight's panel. Our first panelist is Program Director for American Friends Service Committee. She is an anti-prison/punishment and abolitionist activist and a fighter for racial and gender justice. She has worked for the American Friends Service Committee's Michigan Criminal Justice Program for over 17 years, advocating for and with people held in Michigan's prisons around various issues related to the inhumane conditions of confinement inherent in caging and controlling human beings. Illuminating and challenging immediate condition issues informs AFSC's long-term work to shift their collective addiction to punishment and vengeance into working towards collective liberation and well-being for all. She is committed to building relationships with imprisoned people and impacted free people as work for justice, healing, transformation, and flourishing is rooted in interdependence and deep connection with one another and the planet. Please join me in welcoming Natalie Holbrook.
Thanks, Danny. Good evening, everyone. And I'm glad I can see Danny because it's funny not being able to see folks. But thanks so much for being here tonight. Can you hear me okay?
Yeah, I can hear better. No.
Are you doing everybody?
Yeah, just introduce everybody real quick. Right. Yeah, okay. Our next panelist is a former juvenile lifer who was incarcerated during the pandemic. He served 33 and a half years in the Michigan Department of Corrections and took every self-help program the MDOC allowed him to. He even co-created a restorative justice program that had run for 5 years until COVID-19 shut down all programming. Because of COVID, his release was postponed and he was subsequently released in August of 2020. Please join me in welcoming Jamal Tipton. Our next panelist is just a regular person with several loved ones incarcerated in the Michigan Department of Corrections over the last 35 years, some guilty, some innocent. She is a Medicare and life insurance agent and has no political background or interest. Please join me in welcoming Ms. Ernessa Barnett. Our last panelist is the Director of Child Advocacy and Community Benefit for Michigan Medicine. She is also a member of Public Health Awakened and a community organizer with Washtenaw County-based Liberate, Don't Incarcerate. She works to promote and protect the health of people and communities where they live, learn, work, and play. She is committed to addressing structural violence, including that of the carceral state, so that everyone has the chance to thrive. Please join me in welcoming Ms. Maria Thomas. And so, as of date, there have been 24,493 positive cases and 136 deaths inside of Michigan's prisons due to COVID-19, as reported by the Michigan Department of Corrections. Starting with you, Natalie, would you please share with us what activists have been doing to help curb the impact of COVID-19 inside Michigan's prisons? Natalie?
Sorry about that. I lost my Zoom screen. So thus far, we have been organizing since the very onset of the virus and trying to focus on decarceration first and foremost to get as many people out as possible. And we ran into a lot of obstacles all along the way to those requests. Very early on in the pandemic, multiple organizations sent letters requesting the governor to issue an executive order. This is before her executive order authority was stripped by the courts. And we asked her to include people in prison in some of the executive orders that she was issuing. We wanted the governor to grant commutations and clemency to older folks and vulnerable populations inside the system. We wanted the governor to ask the parole board to review people who had been parolable lifers who were ready to come home, who'd been down 20 or more years. We asked her to circumvent truth in sentencing through an executive order. This, of course, was before her EO powers were stripped. To get people who were within a year of their outdate paroled. And we basically met with silence again and again. And we understand that all of us were thrown kind of for a loop. I've never lived through a pandemic. And I know that we have lived through serious other diseases. HIV, AIDS was a huge, huge issue, but it wasn't the same as this very virulent strain of a virus that is the most dangerous in congregate and close settings. And we knew from the get-go that it was going to be dangerous for people inside. And so we were scrambling to push agendas that we'd already had. We've been pushing for long-serving people to be released from prison for years. We've been pushing for governors to pay attention to people who are serving long time because we know that they're the least likely to recidivate of all of the people who are incarcerated in our system. And more research points to that all the time. So the department will say that they've paroled pretty much everybody that they can parole. We do believe that there are folks who could still be paroled who are past their earliest release dates or right upon them if they were allowed to take programming in the community instead of inside. So we've been also pushing for that. We had been pushing to be heard by the governor in a sit-down meeting. We finally had that happen right before the holidays. This took a lot of collective effort. When I'm talking collective effort, I'm talking multiple organizations and individuals coming together to leverage our power to push and push and push so that we could be heard. It took months, I'm talking like December, before we actually were able to have a meeting. Now, that doesn't mean that things weren't happening before that. There were legislators who were interested in this issue who've been sending letters to the governor and in communication with the governor's office. And we've been in communication with those legislators, really strong allies who care. Even the Senate Oversight Committee had multiple hearings on the state of what's happening in our prisons and questioned the director in the Department of Corrections about how they were handling the pandemic from both the perspective of staff in the system and from the people who are forced to live there. And so there's been things that have happened. We've had Twitter storms, which in the fall time, in our second set of, it was in November, our second set of really pushing a Twitter storm. Josh Ho from Safe and Just Michigan is a Twitter extraordinaire and had organized us and taught us about the joys of Twitter back at the beginning of the pandemic. And so we had another Twitter storm in the fall, and out of that Twitter storm, a reporter did ask the governor a very explicit question from the Twitter storm that Josh had raised in one of his tweets. And she, and maybe Ernessa will talk about this a little bit, but she basically gave the facts around the fact that we have been testing people inside a lot. It's great. Every week, everybody's getting tested. But the problem is there's not a way to social distance in the prison context. And I know Jamal's going to talk a lot more about that because he's lived there and he knows what that's like to not be able to socially distance from people. But so they are testing, and we are indeed, like, thousands of people have been infected, more than half the population, and 136 people have died. And so all of the things that we were pushing for from the very beginning, surrounding decarceration, went unmet, and we saw surges happen in the department. And I'm not saying that nothing has changed or nothing for the good has happened. People inside are being provided a multivitamin by the department. They are being taken out to hospital. And we had been worried at the onset that the public may put up a fight if prisoners were taking up public beds in hospitals. And thank goodness that didn't happen. So the DOC will move people to hospital if they need to go. But at the onset, that had been a concern. And at the onset, it was also a concern, and it's still a concern, that if you test positive, you're segregated. And at the very beginning, people were taken away from their property. They didn't have their property. They had nothing to do. They were very sick. And there wasn't much care for them at all, except if people inside were taking care of one another. And that has been the story that keeps coming up for us, is that other prisoners have helped take care of people. Nursing has not always been super happy to treat people because they're scared of the virus. And so a major theme that's come up in reporting is that the lack of compassion among healthcare, because everybody's stressed out. There are people who are working overtime in multiple prisons because the staff have also been infected with the virus. We have no idea, and I'm sure epidemiologists will study this down the road at some point, but how much of the virus came from outside by officers into the prisons, infected the prison population, infected staff, and then brought it back into the community, this sort of cycle of infection. And so we still believe decarceration is the number one thing that should happen, and that we need to put things in place for future pandemics, because this may continue to be a trend in this on this planet that is experiencing climate crisis, changing political demographics, and there's geopolitical stuff happening all over the world. And so all of this stuff may lead to more pandemics, and we need to really think about prisons and jails when we think about, and detention centers, where people who are being held on immigration violations are being held. We have to think about people who are in congregate settings and not put them to the bottom, because these are folks who are our loved ones. They're people that we care about, and they are part of our community, and all of this impacts our community. So including them is really important. Some of the other things that activists have done, we've had various organizations have had caravans to try to make a public statement and protest during a pandemic, which is hard. But there have been caravans at the Capitol, at various prisons, at Gus Harrison, at the women's prison. And so people have come together trying to let people inside know that we care. I know that the men at Gus Harrison were really thankful when folks came out there and had a rally and they could hear them. And when we did a caravan in September at the women's prison, the women, we could hear their voices like echoing through the woods. Danny stayed in the parking lot while we did the caravan, and we could heard their voices, like, no, they knew we were coming, and they were screaming on Big Yard. And we're so glad to have us there in solidarity. Some other things that folks have done that are more like on the ground sorts of relief. There have been multiple forms of mutual aid that have happened. So groups of people have gotten together and bought secure packs for people. There are people inside who've given the names of folks who needed secure packs, and then those people bought those secure packs. Folks have raised money so that we could pass out gift cards to loved ones of people in prison so that they could afford the very expensive phone calls. And now there are video calls, but they do cost $3.20 for 20 minutes. And they're very thoroughly monitored to the point where you could be on a visit and there's only one person in the visiting room on a video call, and the officer is making the person keep their mask up. And getting like on them, like over their shoulder, like mask up, which is just like, doesn't make any sense. So it's a hostile environment. For those of you who don't know, one 15-minute phone call costs $2.56. It's a crap ton of money for 15 minutes. And that money, $1.13 goes to GTL, and the other amount goes to the Department of Corrections to pay for programs. And as many of you know, people who are serving long time don't have access to programs. So loved ones of people serving long time are paying for other people's programs. Programs have been shut down at any prison where there's an outbreak. Even at some prisons where they declare the outbreak over, programs will start back up, and then they'll shut them down a couple of days later because a few more cases have popped up. Movement is very limited in most facilities. And even where programs have started back up, like at Handlin, college has started back up, but you go and get your homework and that's it. It's not like in-class instruction with anybody. So there are people who are waiting for programs before they'll get paroled. And we will continue to monitor that and make sure that people do get into the program that they're supposed to get, or get out and get programmed. That's what we're going to push for, like not having to wait for a program that may not even be impactful because people are so stressed out. So it doesn't really make sense to do this in this time. And do we really know the effectiveness of at the end of your term program? Maybe you've been down 18 years and you need to complete VPP, but you're already chill as you can be. So do you really need it, or could you do something else in the community? VPP is Violence Prevention Program, by the way. So we are going to continue to push for the humane treatment of people inside and for people to be released. We'll be pushing for vaccination across the board, and I know Maria is going to talk more about vaccination tonight. For every person to be vaccinated right now, people 65 and older in the system are considered 1C in the regular rollout. And so they are being provided Moderna. I think they've vaccinated 3,400 people. I think that's right, around that. So that is great, but there are 33,500 people in the system, and the virus is going to continue to be there. People haven't had visits, many people since January, because flu was everywhere, and prisons were already on quarantine when the quarantine hit in March. So people haven't seen their loved ones, they're despondent, their mental health is very frail, and we don't have comprehensive trauma-specific mental health services. And so people are suffering, and the public should know that. They should know that people inside are suffering in a completely other layer of suffering. We're all in this together. We've all been on some form of lockdown, some people more than others, but it is not the same as being in the prison context. And so this is a huge public concern. If folks want to get involved in any of the work that's going on, please get with Danny. And I do have a survey that I can't find the link for right now. I've been looking for it for like the last hour, for family members, that we've been just documenting what people have experienced. I think it's really important for people to tell their stories and the stories of their loved ones. What does it mean to be disconnected like this for a year from your loved ones, if your loved one listening to this, and document it. I also suggest documenting phone calls. So like, this is a moment in history for us to record and keep. And when your loved one calls, ask some questions about what it's been like to live through this pandemic inside, and record it. And it can be a really powerful thing for you to have, but also for the rest of us to have, like a time capsule of this moment in time. And we can use it in advocacy work down the road. So we're going to keep pushing to end life and long sentences, and get as many people out of prison as possible. This is just one more demonstration of how prisons don't help public crises. They create more public crises.
Thank you, Natalie. And just to follow up with the question, I know we spoke about, and you mentioned release valves that the MDOC could use. Could you speak more a bit about these release valves?
Well, the problem is this: we don't have very good release valves. And so for folks, I'm just going to give you a quick 101 on truth in sentencing. In the 90s, there was a legislative group called ALEC that pushed for truth in sentencing policies across the country. In Michigan, we decided to adopt 100% truth in sentencing. Prosecutors got right behind it. They were like, if you are given a 10-year, you're going to serve it. And you can't get out any other way except through commutation, essentially, or medical commutation. And so we have a really draconian system. We also have one of the longest lengths of stay. Average length of stay is about 7 years. And so we have sentencing problems, and we have a large population of people. 14% of people are doing life and long sentences. And so that creates a bunch of folks who are not releasable. There's no way to get them out because truth in sentencing, or they're serving all day. And by release valves, I mean, we need compassionate release that actually works. We have a medical parole statute in Michigan, and during COVID, not one person has been released with that medical parole statute. That's a huge problem. So that is something we're working on with the governor's office to hopefully amend that. But we have to have prosecutors step out of the way and let us get some compassionate statutes out there. The other thing is that we have parolable life, which means that people come under the discretion of the parole board at either 10 or 15 years, depending on when they were sentenced. But the parole board, for the last many years, has basically interpreted that law to mean that life means life. And they're not releasing people. I've just been going through a bunch of folks who were going to ask to be considered. And there are folks who've been down for 40 years. I'm looking at somebody who went down when he was 18 on a second-degree murder, and he's done more time than somebody who was 17 on a juvenile life without the possibility of parole would ever do now, right? And so I think that we have to loosen up parolable life, and we have to have a governor who wants to commute people and who is willing to get as many long-serving, long indeterminate. So if you're sentenced to 40 years tomorrow in Michigan, you got to serve all 40 years. There's no getting around it. If you were sentenced before 98, you can get good time credits or disciplinary credits. But we have to loosen this stuff up. It doesn't make any sense. So we will be working to cap life sentences. We'll be working to amend the medical parole bill and I don't even want to call it medical parole. I want to call it compassionate release. And then in the future, not right now, it's not happening. I think prosecutors will stand in the way of it. We have to get rid of truth in sentencing and have earned credits in Michigan.
Thank you, Natalie. Thank you for sharing that. And moving to Jamal, I myself being someone who is formerly incarcerated, I wasn't incarcerated during the pandemic. So I can't even imagine what that's like for people who are currently incarcerated. As someone who was formerly incarcerated during the pandemic, would you please share with us what that experience was like for you and how that impacted you?
Well, my name is Jamal Tipton. I was a juvenile lifer. In September of 2019, I went back and got resentenced, but I had also one of those parolable lives that Natalie was speaking about. And I guess you can say the grace of God, I had a public hearing scheduled for April the 14th. So my mind is focused on that. And in March the 4th of 2020, When I say they locked the facility down, they blew emergency count, which is when they send everybody to their cells. All non-custody people must exit the facility, and they lock us in our rooms. And for most of the prison, there's no access to the restrooms. There are only a few cells with restrooms. Other than that, you're in your cell and you're not allowed to come out until they say you are, no matter how much nature says you must. And their thing was they locked us down because they said it was a big case of the flu going around in one central area of the institution. And there's a lot of cases on one wing, and there's 60 people per wing, 4 wings per unit. And there was a lot of cases in one congested area. So they locked everybody down. They sent healthcare to the unit to see what was going on, to test the guys. And some of them had the flu, some of them didn't, some of them were still sick, and they didn't understand what it was. At least that's what we were being told. A day or two later, about a day later, they allowed us out ourselves, but the nurses had to go around to each individual unit and ask everybody, did you have any flu-like symptoms? And you were not allowed out of your cell until the nurses passed by when they got to your unit. There was one particular guy who had a public hearing scheduled for, I want to believe, March the 12th. I believe he was one of the very last ones to make it to a physical public hearing. And they locked the institution down again. This time, they fed us in our cells. We were not allowed to come out except to use the bathroom, and they put 2 red squares up against the wall where people had to stand in line in order to use the restroom because they only allowed 2 in the restroom at a time. COVID restrictions. The officers was walking around with masks for about 3 weeks. Other people just started to put masks around their face asking, what's the problem? Well, it's a bad case of the flu, and we don't know. We hear on the news about COVID-19. We're not really conscious of it being there with us at that time. And for about a week and a half or so, they passed this Theraflu out, thinking that would help with the symptoms of COVID-19. And it didn't. They fed the kitchen workers were the only ones allowed out of their cells. Everybody else was in cell only, no other movement except prisoner observation aides, where the prisoner observation is where we go and monitor people that threaten to harm themselves, or if they're in a medical crisis and just need someone to monitor them. That was the only movement outside visitors for the school building and healthcare. They're essential workers. And this misdiagnosis led to a few people going to the hospital still not knowing what they had and brought back. And then once the revelation of COVID-19 being there actually hit the consciousness of the whole institution, their first response was, if you catch COVID-19, they're empty segregation. They let people out. They deemed was less threatening, and moved the other ones to another unit. They did a lot of shifting, and they had segregation as the default place to put people that had COVID-19 that tested positive for COVID-19. But they still had prisoner observation aides going over there. They still had officers in and out. Some officers wore masks. Some officers wore gowns on a particular side that they had the people with COVID-19 on. But by and large, there was no real protocol or procedures in place, because they said as they get it from Lansing. By the time it gets down to the officers, somebody somewhere done changed the rules of how it's supposed to be implemented. Guys were sick all over the place. We had no yard. We used to get 6 hours of yard per day. We went to no yard for, I want to say, 6 weeks. They did not pass masks out to us until, I want to say, 4 weeks later. The officers had them, but we were not allowed to have them. Like I spoke about earlier, some guys just went to tying things around their face because they said if the officer should be able to hide their face and have protection, we should also. But their response was, we're not allowed to cover our faces. So eventually, somebody somewhere said we were allowed to have masks. So they passed everybody out one mask. Not very good quality, but they passed out the mask. And the kitchen workers, I don't know, a little bit more than a third of the kitchen workers had COVID, and they were the only ones allowed to go to segregation, which later turned into being transferred out of the facility to other facilities where I think Adrian was being one of those facilities where they allowed the COVID people that had COVID to run the institution as far as cooking, cleaning, things of that nature, running the maintenance of the prison. People are still getting sick and they still don't understand how to diagnose it. They still don't know what to do. Then the scramble. And later on down the line, they told us we'll be COVID tested for antibodies. The National Guard, I believe it was, came in, tested everybody. A week later, they COVID tested everyone. The institution did. I believe the National Guard helped with that also. And still locked down, still no yard movement for weeks on end. And eventually they gave us 1 hour per yard per week. Eventually, I want to believe it was 3 months later, they gave us 6 hours a yard per week as opposed to a day. It was better than nothing. But the way they still treated people. So when they did the antibody screening, they passed everybody's papers back out. Some people had to go to healthcare. Some of it just came in the mail, whether you tested for antibodies or not. A few days later, they had been shuffling people in and out. They had also shut down the school building and started using the school building as a place to house people that had COVID-19 or that was their recovery area, where they put up makeshift beds everywhere in the school building, in classrooms, the gyms, and even the hallways to have the recovering. Eventually, the test came back from when we were COVID tested, and they had 104 positive cases. In the beginning, if one person caught COVID, they would also take their bunkies, which is your roommate, to segregation with you because they were contact tracing at the time. That's the way they were saying of keeping it together. You and your bunkie and a few people that were the other 58 other people that was on your wing, that's really who you interacted with, as much as they would allow us out of our cells in the hallways. In order to get our meals, we had to go to the bottom of the stairs or up the stairs, depending on which wing you were on, and go back to your cell. And then they would come around and collect the trash. And when these 104 people came back, they started moving people in the middle of the night, early in the morning. They came with their masks and their gowns. Pack your stuff, you gone. And they took them to housing unit 5, where they eventually started keeping a multitude of people that had the spillover from segregation into housing unit 5 also. So they put those 104 people dispersed throughout around people that actually had COVID. 2 days later, they came back and said, we made a mistake. They were false positives. You all did not have COVID. But now that we have exposed you to COVID, we're going to clean out the school building, put those people somewhere else, and put you all in the school building for a recovery phase just in case you were exposed to it. Months later, it was still people that had not gotten out of segregation or out of housing unit 5. When I said months, 3, 4, 5 months, they still were testing positive for COVID, but they're out amongst the people. And myself personally, having a public hearing scheduled for April the 14th, and the last one I believe being March 12th, they shut all of that down. There was no court movement in the courts or anything, parole boards, anything. It's up in the air now. It gets postponed. And on behalf of Natalie and the American Friends Service Committee, along with other organizations that she spoke about earlier, they drafted a letter and sent it to the governor. I don't know if she read it. I don't know. But some of what I read in that letter was asking the governor, you have the technology. Why not allow Zoom and things like that to allow these public hearings to go on? They do not have to be stopped. These people are being prolonged in here, and again, being exposed to COVID when they have a possibility of going home after all this time. They granted it. Me and another guy, we're in the same situation. We end up going together. He was the second one. I was the fourth one to have my public hearing via Zoom. So thank you for the American Friends Service Committee and other people for at least extending the letter. I hope that was what helped. And in that, now I'm panicking because what does that do for me with all this COVID around me? They don't know what's going on. And as far as people are paroling, at first they started out where you had to be COVID tested 21 days before your release. And then it went from 24 days to 21 days to 14 days, from 14 days to 10 days, from 10 days to 5 days, and to eventually 3. And I'll get to that in a minute. But so I asked the warden, I said, I have a public hearing scheduled via Zoom. If I happen to catch COVID and they quarantine me and it affects, how would that affect my public hearing? He said, I don't know. That's a good question. I said, well, can you give me some answers? He said, I'll check into it. I proceeded to my housing unit where the parole board coordinator had an office in there. So I asked her the very same question. She said, I don't know. Good question. I'll check into it. The next day, she called me to her office and said that they would still allow me to have my public hearing. And I told her I'd go up there in a garbage bag if I had to. I just wanted my opportunity because they don't come along very often. They really don't. So I was doing everything I can to bring attention to make sure my opportunity was going to be there for me, even if I had to go in the garbage bag. Not dead, but as far as protection. So I had my public hearing. We're waiting. But again, I'm still around COVID. I don't know what's going to happen. So eventually I get my date. So now I'm asking months in advance, can I get COVID tested early? Can I get COVID tested early? So if I do have it, you can quarantine me now. Please do not affect my release date. But back to some of the other people that got taken at 104 of the false positives, One of the guys actually had a parole and it delayed his parole. They called his people. This people come to the institution. They said he could not be picked up at that time because he was under COVID protocol. Maybe 3 days later, they finally allowed him to go home and they called his people to come back there and pick him up. And I forgot exactly where he stayed, but he said it was a little ride. You know, they took a while, but a few days later, they had finally allowed him his parole because they had stopped. They would have finally found out that it was a false positive. Sad to say, another juvenile lifer had passed away because of COVID. He didn't get a chance to come home because he caught COVID and passed away. And some of the fear with COVID amongst us as incarcerated individuals, you get sort of complacent to a certain extent about your surroundings in regards to how you jail, so to speak. And certain people would get sick. They would try to stay in their room with a bunkie and withstand going through the COVID because they didn't want to give up their place there. They didn't want to get shifted around because there was no guarantee that they would come back to where they were at. Even though in some cases they did return people to the actual institution that they were at. And a few people had to succumb. A few gentlemen in different units got together and said, hey, I don't care what they say about this snitching thing. It's more about our health. If we don't stick up for ourselves, how can we get mad at the officers for not sticking up for us? If we find out somebody got COVID, they got to go. So guys went to the desk when they found out guys were sick and they got them out the unit because again, it was about a health crisis. It was about saving lives. And some guys stepped up and did that. So, but again, the moving around, the sending people into places where they knew COVID was, then you get these false positives. I they had to do something, but that something could have been a whole lot better. Thank God they still allowed me to be released under the COVID protocol and everything, and I left with a mask, and I have no problem with it. Thank you.
Thank you. Thank you for sharing that, Jamal, and welcome home.
Thank
Welcome
you.
home, bro.
Thank you. Glad to be here.
Mm. I know that was a difficult time for you, man, and I thank you for sharing your story and possibly reliving that. Thank you. And hey, Ernessa,
Hey,
how you doing?
I'm good. I just want to talk
So,
about, the fact that so many people are not aware of what's really going on in the prisons. And it's like so irritating to me. Even for example, with the recent Capitol stuff, and one of the guy's moms called a jail and said, "Oh, my son need to eat organic foods." And then you had people on the View and other programs talking about how people in prison are able to eat organic foods, and it's so many misconceptions where they think that prisoners don't have it as bad as they really have it. They don't realize that, it's not what they're hearing, that that guy was not going to get any organic food, especially not in any Michigan prisons, no matter how his stomach is. But it's so many misconceptions. And even as far as like when the governor give her speech and talk about, how MDOC is taking extraordinary measures to prevent the spread of COVID within our prisons. And it's like, I know that's not true at all. And she talked about how the cells are washed down once a day. That's not true. And especially at the women's prison, where they're given, they have a porter to go around on each side of the wing to get to about 100 people. That porter can't start until 30 minutes before count. So that's at 10:30 in the morning, and at 3:30 in the afternoon. And that porter has to be back by 10:45, 15 minutes before. That's when lockdown starts, at 15 minutes before the count time. That starts at 11 a.m. and at 4 p.m. There's another one at 10 or something like that, but this bleach goes around at 10:30 and at 3:30. And that porter has only 15 minutes to get to 100 units, asking everybody, do you want bleach? Some people turn it down, don't even want it. I don't know why, but they don't. But those who she give it to, they have 15 seconds to hurry up and spray the toilet, spray the sink, and spray the door, and hand it back to the porter. Then the porter have to rush along to the next one. And if a person don't jump up and say, yes, I want it, the porter keep on going, because she only has 15 minutes. And that's not enough time and it's not that's the time that the porter wants to go. That's the soonest they'll let the porter go. That's the scheduled time, because they don't want every cell to be washed down with bleach. They don't want a lot of bleach to be used. They do allow them to go up to the desk when there's bleach available and put a little bleach on some paper towel or rag and take it back to their cell. But it's not like the governor thinks it is, where they're having their cells bleached down every day. It's not like that at all. And then as far as social distancing, like it was discussed, it's impossible to do. And at one time, the guards it's like they go to the extreme. Now the guards are not making them wear their masks, and they need to wear their masks, because a lot of people have to be told to wear their masks. They used to ticket them and take it real serious. And I think that's mostly because the guards were afraid themselves of catching it. But now that the guards are more equipped, some of them wearing hazardous material suits, some of them wearing shields, and now they don't even make the people wear their masks. I guess except for when they're on the phones, they're fronting, because they shouldn't make them wear the mask then. But aside, just in everyday day living, they don't enforce masks anymore. And that's not good. And also they allow the day rooms to be crowded, which is not good. So how can they social distance when the day room is crowded? And the phones need to be repositioned, because the phones shouldn't even be in the crowded day room to begin with. And they need more phones too, and to fix the phones that are down. And as far as like the things that the prisoners can do to help themselves, one of the main thing was they should wear their masks since they're not being told to anymore, and like build their immune system. But they've taken away that ability from them for them to be able to build up their immune system by not stocking the vitamin C, when it was no good reason to not have vitamin C. Because I called Keefe, the vendor, and Manson Naturals, who actually makes the vitamin C that's distributed to the prisons for sale, where we can buy it for our loved ones, or they can buy it from the store. It's the same vitamin C. And they told me that we had plenty of that. And even when we were out for a minute, and companies that ordered, we got it to them. We were not out of stock long. And if we're ever out of stock, we get it and then we send it to them. But they looked up the orders, and they told me that the last time that it was ordered, that Keefe had ordered for MDOC, was January the 2nd, 2020. And they said not January of 2021, but of 2020. So it's more than 1 year ago. So it's no wonder that they ran out. And they told me how they had ordered 6,000 bottles at that time. And they pulled out another invoice where it was 3,115, but that was in 2020 as well, or 2019, because the last order was January 2nd, 2020. Because I had noticed what prompted me to do it, because one prison after another, my loved ones was telling me, oh, well, they're out of vitamin C. I ordered the vitamin C, but then it ended up not coming, and it says out of stock, and they're going to credit me my money. And then also when I was ordering packages for them too, through Michigan Access, it took my money out, and it showed that they were in stock. Other items such as honey, they'll tell me, oh, that's out of stock, and a few other items. And put the vitamin C, it always shows as being in stock, but yet I get a credit back. And that happened for, 2 quarters in a row. Well, actually 3, because one of my persons got it on at a whole separate time frame. But it happened 3 different occasions. And so I contacted Mr. McGee, and I sent notifications to, well, first I started calling, and the warden's offices would say they had no knowledge of that. And so that's why I decided to write several key people so they can be put on notice and can't say we didn't know, we didn't know. And the people that didn't know, several weeks later, it was still no vitamin C. So it didn't matter that if they didn't know for real. They still did nothing to get vitamin C. So Mr. McGee ended up writing me back, and he told me that they were going to get some on February the 5th. And Keefe had told me they had no order for it at that time. Oh, I'm sorry, Manson told me they had no Keefe order for it at that time either. So I assume they finally ordered it now. And so I'm hoping it does come in tomorrow, at least to Keefe, so that they can start distributing it to people. And also, another thing that makes for crowds is they need to do the repairs in these prisons, because it's ridiculous. Like at Chippewa right now, it's been weeks that they've had 3 of 7 toilets down, one of them smelling horrible. And so that creates a line, and 3 of the sinks are down too. So that makes a buildup. Whereas if they had good repair, people can get in and get out and be gone instead of building up a line. But the guards say nothing when they see it crowded for the restroom, when they see it's crowded in the day room, they say nothing. It's like they're not enforcing anything now. It's like they're not trying to reduce the spread. It's like they're trying to increase the spread from what I see, and putting guys who have tested negative over and over in step down where all the positive people go after quarantining, and pretending to think that they had a positive test when the records clearly would show that they had all negative tests. So that's another thing that's not good. And as far as the Therum M, a lot of prisoners can't take that because a lot of them got sick. And when I looked up the side effects, because I know when my loved one had taken it, because he has stomach problems and ulcers, he got really, really sick just taking 2 of them. But then looking up the side effects, it showed that it can cause upset stomach. So if you already have an upset stomach, you really don't need to take it. And it showed that it can cause constipation and diarrhea as side effects, because the Therum has iron in it too. So if people take medications that say don't take with iron, then they can't take the Therum. But all they really need is at least the straight vitamin C when that's available. And so it really has me worried about my loved ones, because MDOC is not trying to protect them. They're not doing what they can to protect them at all. And I really think they need to be investigated so that, these things can be taken care of. And especially like them mixing them, letting them go to yard together, the positive and negative people, and letting people who are positive and supposed to be quarantining, letting them off quarantine after having them on quarantine for 5 days, letting them off, letting them work in the kitchen, and then the next day putting them back in quarantine. It's like, what kind of quarantine is that? That's not a true quarantine. And just a lot of things that they're doing that makes no sense. Oh, and I wanted to mention too, I know up north, like near Kincholi, where the Chippewa Valley, where the Chippewa prison is, I called the War Memorial Hospital. That's like the closest one to them. That's like a 22-minute drive. And the person there, a couple of different nurses, because I called and got 2 different people. And they told me they only had, I forget the number, I wrote it down, but it was something like less than 300 beds. And she said all of those were not set aside for COVID-19, because I was concerned about when the prisoners have to go to a hospital. And, they don't have many beds there. And the one nurse told me, well, because this is a small community. And I told her, well, actually, it's a large community when you count the prisoners. It's like nobody's thinking about the prisoners. And after that particular hospital, the next closest is Gaylord, which was like, it was over an hour drive. And especially if there's a lot of traffic. And then there's another one, I forget where that was. I think it was Traverse City or something like that. but that's just way too far for when the inmates have an emergency. And the one hospital that's so tiny is full, but I'm gonna have to go so far. They could easily die with even just trying to get there. So I think these are like serious issues that they're not looking out for the prisoners. And in some of these areas, they really can look out for the prisoners. And I wish the governor would have somebody to go in and investigate to find out what's really going on, instead of just listening to the lies that MDOC tell them and act like they're doing things right and have it under control when they're not enforcing things that they should enforce. And they're just not doing. Oh, and another thing too, credits. I understand about the truth in sentencing, but there's a lot of people that were there prior to truth in sentencing, and they're eligible for credits. And these prisons are not even giving them, even when they have no tickets or anything, they're not giving them the credits that they're supposed to be giving them. And then they could even restore credits that were lost as well. And they're not doing that like they're supposed to be doing. And I know, like with my fiance, he put in for his credits and asked for credits to be restored. And the warden sent it to Mr. McGee. And that was like 6 months ago. And he never heard anything. So they're telling him that, well, if you didn't hear anything, that means it was approved. So we don't know if it was approved or not approved, because never heard anything. No response. And no response to the request for a response. But they could definitely do better, even if their hands are tied with those that are not that are under truth and sentencing. But those who are not under truth and sentencing, they're not doing what they can to move them out of there at all. And I understand prison is big business, and the longer they keep them, the more money they make off of them. But they're definitely not doing their parts to get them out, and they don't care about the prisoners' pain. They're so inhumane, tell them to wait till after COVID. Like guys that have toothaches at the prisons, tell them we don't have a dentist. You have to wait till after COVID is over. And when you're in pain and have a bad toothache, that's torturous to have to wait until after COVID, when we don't know how long it's going to be before COVID is over with, if ever COVID is over with. But they're doing nothing and tell them to buy aspirin that doesn't work. And it's like, they're very insensitive to the prisoner's pain. And they still call them, like, I know, like, even at the women's prison, whenever they put in a kite for a health reason, instead of taking care of two things at one time, they take care of one thing at a time so that they can get that $5 fee from them. Then that has them going to medical more often than necessary. And that's what makes it take so long for people to get appointments. Because when they could be handling 2 appointments in one sitting, talking to the same person that they'll talk to the next time, they just keep it separate like that. So we need somebody to like oversee the prisons and not just listen to what they're saying about they have it under control and they're doing this to prevent that. We need somebody to oversee, and especially to oversee these vaccines, because I don't trust them with what they're, is it going to be a real batch and an untampered batch to these prisoners? That's all.
Thank you. Thank you so much for sharing that, Vanessa.
You're welcome.
To have so many loved ones incarcerated during this pandemic, I know that has been extremely difficult for you and your family. So thank you again for taking your time out to share your accounts, as well as the accounts of your loved ones, the conditions, what they're going through inside. Thank you. Thank you for sharing that. And now we're aware that there's been a prioritization for the vaccination, and we would love for our next panelist, Ms. Maria Thomas, to share with us the perspective on why people held in jails and prisons should be prioritized for the COVID-19 vaccination. And again, like I definitely would like to just encourage everybody, if you have questions, please put them in the chat box. We will take a minute to do question and answer. So please bear with us. Thank you. Maria?
Thank you, Danny. And thank you all who are joining us. I also want to really thank Jamal and Arnessa. Thank you for honestly sharing everything you've been through, and welcome home, Jamal. So happy that you're here with us. And Arnessa, I only hope that your loved ones are able to return soon to you, and that they're kept safe in the interim.
Thank you.
Yeah. So I wanted to, in addition to talking about vaccines, provide a public health perspective on this crisis of incarceration. And Natalie had mentioned, right, how decarceration is really important. And I would say that decarceration is not just important in the context of a pandemic, but incarceration is a public health crisis, and decarceration needs to happen, period, because it is against everything that public health stands for. So on the next slide, I just wanted to provide some context for what some of the public health thinking is on the topic of the prison industrial complex. And so this is a statement from last year. This is the American Public Health Association. And they're a professional organization of something like 25,000 public health professionals, healthcare professionals from across the nation. And they are unequivocal in the fact that they recommend moving towards the abolition of carceral systems and building in their stead just and equitable structures. And so their recommendations, and these are public health professionals, their recommendations are to urgently reduce the incarcerated population, to divest from carceral systems and invest in the so-called societal determinants of health. So things like housing and employment and mental health counseling. Those are the things that will keep our community safe, that'll keep our communities healthy. And so the other thing that they recommend in this statement that was passed something like 92% to 8% by the voting membership is committing to non-carceral measures for accountability, safety, and well-being. Because this perpetual punishment does nothing to keep our communities safe in the long run. So we have to be thinking about things like restorative justice and transformative justice and addressing the root causes of violence and harm in our communities. Then re-enfranchisement is another thing that public health professionals and others in the field unequivocally recommend, as well as funding research to evaluate how these different initiatives go. So that's the context of public health writ large, but there are also very specific public health recommendations that I wanted to share with those of you on the call. And this all echoes the stories that Jamal and Arnessa shared, right? They talked about just the horrific, inhumane treatment. And so these COVID-19 recommendations from Human Impact Partners, who is one of the lead organizations in the space, their recommendations have to do with release. We talked about those release valves. Well, focusing action towards mass decarceration is the first order of business that we need to not lose sight of. And then we need to advocate as a community and people who care against transfers between carceral facilities. And I know there are some community health and medical professionals and others on the call. I recognize some names, but everyone needs to be adding their voices to say that no transfers between carceral facilities, decarcerate now, because in those transfers, and we're hearing a lot, right, of people being shifted within facilities and across facilities, that is leading to more of a spike in the number of COVID cases, which I'm sure you've read the reports of, not only have we lost 136 people, but the rate of COVID-19 within prisons is something like 5.5 times higher than the rate in the general population, because it is impossible to socially distance or protect oneself like one would be able to in a non-confined setting. The other point that Arnessa had raised about just the poor lack of access to healthcare and the extractive nature of, how those visits and copays are squeezed out. We have to improve healthcare access for people who are currently incarcerated, and that includes releasing people to community-based clinical care. This is the public health recommendation. And then the bit about vaccines Danny mentioned, I mean, in the Michigan plan and in other states, right, congregate facilities, long-term care facilities, those have been prioritized. And given that those facilities and prisons and jails have been the highest COVID hotspots, there is no reason to not prioritize incarcerated folks in these vaccine allocations. It is the opinion that it must be a priority for vaccine allocation if we are approaching things from a public health perspective. The next slide goes through 4 more of the recommendations. So Jamal had mentioned how those who tested positive for COVID-19 initially were sent to solitary confinement. And we know from the research, right, and just from the stories of personal accounts, the use of solitary confinement units, that has been categorized by the World Health Organization, human rights organizations everywhere, as torture. So prisons themselves are sites of so much violence, so much harm. And using the whole is especially heinous under pretext of, that's the only place that you can isolate someone. And this leads to problems or challenges with, again, those inside being rightfully concerned about getting tested if that means that they're going to be sent to solitary. So we have to ensure that COVID-19 testing is equitable in design and enforcement. And so that means non-coercive. Prisoners should have the right to opt out. There is completely warranted distrust in the Department of Corrections and in medical professionals themselves, right? There's a long history of abuses and horrors. And so there has to be acknowledgement of that and ways to promote transparent, accessible, and regular reporting of what is happening. So, and that includes testing, cases, and deaths. And to Arnessa's point about people give non-factual accounts of what is happening behind bars. Those who have loved ones inside know what is happening. And so we have to be able to shine a light on what is truly happening. And anyone with the power to be able to have that oversight, and I know local health departments do have jurisdiction to do 1 to 2 inspections a year. I mean, anyone with that kind of access has to leverage the power of inspections to document abuses and neglect occurring inside carceral facilities so that those can be addressed. So those are some of the public health recommendations from human impact partners that I wanted to share. But I also wanted to share some answers to some Q&A, some frequently asked questions. And this is put together by Community Justice Exchange and Public Health Awakened. And Danny, how are we for time? Is it all right if I go through some of these or like all of these, or maybe pick some?
Good. We're good on time.
Okay, great. Okay. So then, what I'll say is, one of the questions, and we often get pushback from policymakers. It could be colleagues, it could be general community members who are just ill-informed about what is truly happening and what needs to happen. So one question that we'll often get is, why not just release the medically vulnerable and or elderly people? Why release everyone? And I think what has been so apparent from the stories shared is that there is no way for people to be safe inside carceral facilities. So if we're talking about public health, if we're talking about prevention and infection prevention, that should be accessible to everyone. That has to be the priority, because it is impossible to stave off in infection, the only way to sort of limit unnecessary sickness and suffering is to release as many people as possible. Will letting people out of jails and prisons bring infection into the community? I think Natalie had mentioned how oftentimes correction officers bring sickness in and then it cycles back through to the community after it's transmitted to those inside. And the truth is, the answer to the second question is letting people out of jails and prisons is actually the most prudent infection prevention strategy. So quite the contrary. It's the opposite of will letting people out bring infection. It will actually reduce the likelihood of infection because people will then be able to stay safe and socially distance and do all of the behaviors and take all the precautions to reduce that community spread. The next question that can sometimes come up is, can people quarantine inside jails or prisons? And I think we've heard the answer to that through some of what was shared earlier on. And the answer to that is no. There's when you have to line up for use of the toilet, when you are worried even about how testing is going to be administered and whether they're going to be crowding many people in that site, it just makes quarantining inside jails and prisons virtually impossible. And so another reason to push for mass decarceration. Sometimes people ask, can we use electronic monitors to release more people? And the answer to that is, although it is pushed for by some quarters, it's not an acceptable alternative to true release. Because from a public health perspective, we have to be able to protect people's freedom of movement. And electronic monitoring flies in the face of current guidelines that, I mean, it'll make it harder for people to actually do true physical distancing. And also what it does, electronic shackles and monitoring does, is it limits people's access to things that they need. It could limit people's access, because of the limited freedom of movement, to things like healthcare, to things like food. And those are things that we need to survive. And so using electronic monitors as an alternative to true release is not something that we would encourage. Are people safer in a jail or prison because it gives them housing, treatment, and food? Is sometimes a question we get from people who are well-intentioned, and sometimes, honestly, it's just a bad faith question that we get. And here's the public health perspective. People are never safer in jails or prisons because, like I mentioned, they are sites of violence and death. And that's a reality only compounded by the COVID-19 pandemic. The majority of incarcerated people have family or community ready to welcome them home, and they can practice social distancing. And for those who don't, we should never have to put people in prisons in order for them to have access to housing, medical care, or food. If we care about people having access to these basic needs and rights, we should demand investment in these resources outside the criminal legal system. Community-based resources are higher quality and much less expensive. So instead of saying cynically, well, maybe we should keep folks in confinement during a pandemic, what we should be advocating for is really resourcing community-based resources and having people come out, come to their homes, come to their loved ones and their communities so that we can support each other. And when I talk about investments in community-based resources, those can be structural investments that we advocate for, but there's also, like Natalie mentioned, there are ways in which communities are getting together to provide mutual aid, to provide support and resources for those who need it. And even in the absence of those structural changes, there is so much we can do as communities. And so the push should always be release people and don't use these excuses to not release them, saying that, well, we are providing all of these things within, when we know that the quality of those things and is just so subpar. And Sometimes we'll get questions about releasing people from prisons, and is that going to lead to more crime? And the consensus on this is very clear. We cannot incarcerate our way to safety. Though it doesn't lead to more crime, the only way we can really address harm in our community is through prevention strategies and investing and addressing the root causes of those harms. And that is, like I said, investing in the resources we all need to thrive, like housing, like access to food and clean water, and opportunities to create things and access recreation and joy and love and community. And then the last question is, can we use furloughs to let people out now while the COVID-19 risk is high, with the understanding that they will have to return in the future? And to that, the answer is, being incarcerated is always a grave threat to one's health, whether we're in the midst of a global pandemic or not. And if someone can be released from jail or prison now, it shows that they never should have been there in the first place. And so as public health workers, we reject punishment for punishment's sake. You can read through these FAQs and the answers to them that we've compiled on the PDF link at the bottom, and maybe we can drop that in the chat as well. And I would like to leave plenty of time for Q&A, but the last slide just reaffirms some of the organizing principles as public health workers committed to justice, and that Human Impact Partners has centered at the core of their work. And that is, we have to honor that our individual health and well-being is interconnected with our communities. So when an individual is incarcerated, that shapes the entire community's experience, shapes not just the individual's loved ones, but and their families, but the whole community. And so our health and well-being is so interconnected. If one of us is unsafe, that should be cause for all of us to want to do something about that, because it impacts all of us. And then we have to reject proposals that claim to use incarceration and policing as public health measures, because there is nothing remotely related to public health that punishment does. And then we have to promote our shared humanity while resisting false dichotomies. No one deserves to die in a cage from a torturous virus. Everyone deserves to be safe and to live with dignity, regardless of their charges, convictions, or backgrounds. And so we can never, and we must refuse to designate some people as disposable because of their past convictions or current charges. And we've got to reject the false binary by violent or non-violent labels. Everyone deserves to be safe. Everyone deserves to be treated with dignity and humanity and care. So let's promote our shared humanity and resist false dichotomies. And the point about supporting self-determination is, as communities, we have to reject paternalism. Oftentimes, the criminal legal system has all of these conditions about when people can be released, and conditioning released based on one's access to resources, such as housing. But what that does is it just compounds existing inequities. So basically, those who are already better off are more likely to be released. And so post-release resources have to be made available to all without conditions or surveillance. And I think I've mentioned the last 2 points, which are also echoed in the APHA statement, which is we've got to fight for voluntary community-based resources and demand investment in life-affirming and life-giving efforts and activities and communities and transformative changes, and divest from death-making institutions. And that's all I have. Thank you so much for being here.
And thank you, Maria. Thank you for sharing that shared humanity and making people whole and healing and investing in community. That's definitely a direction that we all need to head towards. Yeah, thank you. Thank you for sharing this. And now we do want to we want to honor those that have had questions in the Q&A. And thank you, Natalie, for answering some of the questions that were in here. Okay, and we do have one question, which is from Kwame Hooker. Thanks for tuning in with us, Kwame. And his question is, nationally, there is still a casualness about wearing masks. Is this casualness toward masking a pervasive pattern in Michigan communities where prisons are located? And of course, this is a question that any one of our panelists could take a shot at answering. The floor is open.
Yeah, I would say it is, because the prisoners, a lot of them don't like to wear their masks. They don't realize how serious this is. And that's why the guards should be there forcing them like they were at the beginning. They were ticketing them when they would take off that mask. But now, for the most part, at most of the prisons that I hear of, they just allow them to walk around without their mask on, since the guards themselves have their shields on now, and some of them their hazmat suits. They don't care. It's like, if you don't want to wear it, fine. It seems like they're trying to spread it throughout the facility anyway, so they're letting them go maskless.
And for me, once I understood the seriousness of it, I had no problem wearing a mask. Like I said, the mask that they gave us was not good quality. It was real thick. It was, so you had to modify it. So a few guys, just like out here, they adapted and they start making masks. So there were a few masks made where it was a lot more comfortable. It protected you. I've always kept a mask on because I understand the seriousness of it. Some guys do. Some guys want to play games. Some people want to play games, you know. And like Ernesto was saying, that's one of the rules that I wish the department would enforce. Because earlier, when we were talking about the testing of all the inmates and the mandatory testing of all the incarcerated individuals, there was no mandatory testing for the officers. That's how it's coming in. Because other than that, we were not exposed to it. They shut down all visits in March. So we had no contact with outside people except the people that the department allowed inside. And also, when I was speaking about the COVID testing for people that were being released from 21 days down to 3, they tested me 3 days before I was to be released. And I said, well, wait a minute, what about my results? They said, don't worry about it, go home, because as long as you're going to a home, as Maria was speaking about earlier, you can quarantine yourself because you're at home with your people, your loved ones. I went in the basement to make sure that I was protected, that my wife was protected, and the other people that were around me. I never did get my results, but some other people, like in the beginning, before they did that, yes, they were holding people up. Then they got to a point where common sense is not a prerequisite to have leadership in the Michigan Department of Corrections. Yeah, they just dropped the ball, but then they said, go home. Intelligence finally kicked in and said, go home and, self-isolate with your family, get your own spot, and you'll be all right. That way it's less likely that you will be exposed to it in here. And like I spoke about before, a few of the people that were around me passing away from COVID.
And I wanted to add too, when you were talking about how they were not testing the officers at first either. I think a lot with them being forced to do the testing had to do with what Attorney Dan Manville had did. He was pushing them to do some stuff. And, most people know he was formerly incarcerated himself, and then he became an attorney, and he was really working for the prisoners, and he was doing well, but I think he ended up going overboard when he started trying to ask for prisoners to be housed, and it was either one or all two, no more than 2 persons per unit. When that was a little bit too much to ask for. It was a little unrealistic. That's what it should be. But based on how overcrowded the prisons are and with the truth in sentencing laws and them not being willing to bend, the judges were just not for that at all. And I think that's when, at the point where they no longer respected him and like, get out of here, and we're not even doing anything else for you. And then that's when the prisons saw that the judges were more so taking the prison side now, after Dan Manville had went too far. And they just stopped really enforcing stuff and started doing more things that cause it to spread instead of things that reduce the spread. And I wish we had another attorney out there willing to help, but it looks like Dan Manville was the only one. And I know Thomas Tomko, he helped with some of the state jails, but not the prisons, as far as I know. So as far as I know, it was only attorney Dan Manville working for the prisoners.
I do want to stress that it's not, the federal courts have not been very helpful on granting any kind of relief for people in prison who during this COVID time. It's not, there have been a lot of efforts by the ACLU and SATO and people coming together to try to really think through litigation strategies, and they have not been helped. We haven't been able to go anywhere with them.
Yeah.
I hope that answered your question.